With pregnancy, generally speaking, we're going to see changes in the abdomen and breasts. And so that's usually going to be a combination of a breast and tummy procedure. So typically that will involve an abdominoplasty with liposuction for most patients. Usually there will be some sort of muscle stretch or separation. We call that rectus diastasis, which can cause lower back pain and really weak core strength. And so restoring that as best as possible. So really trying to flatten the abdomen and create a better, contour curve to the waistline. And in addition to that, whatever changes that it's happened with breastfeeding or with breast volume changes, so that can include a breast lift. It can sometimes just be a breast augmentation with volume. You can oftentimes it's a breast reduction. So really whatever the patient needs, changes with pregnancy is what we can provide with the Mommy Makeover. I would say the best candidates for Mommy Makeover are the patients who are still active, still trying to stay in shape and really take care of their body, and their abdominal muscles just really aren't recovering as much as they would like. Those patients are going to see the biggest changes and the biggest improvement with the tummy tuck and a Mommy Makeover. I think when it comes to the breast changes, really if they're just wanting to look like what they did probably prior to pregnancy, or even just adding volume and feeling like a little more of a womanly figure, then those patients are really great candidates. We're even doing Mommy Makeovers in patients in their 60s and 70s. And so I think I don't know that's a necessarily new field in plastic surgery, but it seems like we're seeing more and more moms that are over 50 that really just want to look in the mirror and feel good about themselves.